Hello everyone, I'm Rob Hoyle. Welcome back to another Facebook Live where we're covering all angles of COVID-19. And I'm with health expert Dr. Zenobia Brown, who is the medical director of Northwell Health's Population Health. We're outdoors, we're 6 feet apart, so we took the masks off.
We did.
We're getting outdoors.
Yeah.
Long Island Phase 1 reopening, what does this mean for us?
This is really great, and it's really important for New Yorkers to sort of get out, get some air, get exercise. We know that that influences sort of how our immune response is. That's a good thing. We want to participate in this great weather, but what's really important is just like we flatten the curve to begin with on this, we want to do all the right safety things so that we don't get into trouble later.
Yeah, and so we're outdoors right now, and is it safer to be outdoors or is it safer to be indoors?
Way safer to be outdoors,
Oh.
way safer. So what we know is that it's not impossible to get COVID outdoors, but the vast majority of infection is happening when people are inside in close proximity. So the ability to be this far apart, to be doing your activities with some sort of wind, with lots of space, we feel like those are the safest environments to be doing things apart together.
Okay, but wind isn't dangerous. What if the wind is blowing this way? I talk, and so the wind is blowing in your direction. That's not a danger?
Yeah, so there's been a lot of media attention about things like bicyclists sort of biking past and the part of the viral particles kind of, models about that. And sort of what we understand about that is that our getting infected has a lot to do with the amount of virus that we are exposed to. So in just sort of passing and the wind sort of dispersing those viral particles, we believe what we know now is that that's actually sort of protective. While one viral particle might be moved by the wind hundreds of yards, that is much less likely to infect you than lots of viral particles coming right at your face. So
Right, okay.
We don't worry about that.
Well, Dr. Brown, I have so many questions for you. If you have questions for Dr. Brown, please put them in the comment section. We'll try to answer as many as possible. So, the rule of thumb still carry the mask, and still so wearing masks when less than 6 feet apart in the supermarket, indoors. Outdoors, we could relax that a little bit.
Well, I think everything is about your level of risk. So you could be outdoors and there could be lots of people around you, right? So in that situation, you're going to want to wear the mask. I think caution is the better part of valor in this, and common sense. So if you in an environment like this where the nearest person other than you is hundreds of yards away, you're going to have a sense of security that it's not magic. You have to be exposed to someone to get coronavirus. But if you're in a different setting in the park where everybody's, say, waiting for the restroom, that's going to be an environment where you're going to want to wear your mask. And if you're a person who it doesn't bother you to wear a mask, why not play it safe? Again, we're always thinking about that next thing, and until we have a vaccine, we want to take every precaution. So we don't want to overdo it, but if a mask doesn't bother you, why wouldn't you wear it just to be safe,
Sure.
even outdoors?
I got a little rapid fire round right now. I got a
All right.
list of some things here. So you tell me safe, not safe, and if you want to tell me safety level or whatever. So barbecue.
Barbecue is, again, safe if you can do it safely. So you want to know the who, what, where, and where. Who's going to be there? Are these folks that have been doing good social distancing? What are you going to be doing? Are you going to be eating so no one's going to have a mask? Or can you do some other barbecue activity where you can all be wearing masks? How long are you barbecuing for? Are we going to say, look, let's meet together for an hour. We just want to connect. That's enough. Or are you going to sit there for 5 hours? Drinking, you got to consider that. Once people start drinking, everything kind of wants to get relaxed. So yes, barbecue, but do it in a way that is the most safe and minimizing the risk to yourself and your family.
Okay. Pool parties.
Yeah, so pool is similar. Again, we have what we know now, and things are always changing, is that there isn't really transmission of virus through pool water. So we don't think you'd go into a pool where, say, somebody else was in there and get COVID from the pool water. But the people in the pool are really the issue. So yes, pool parties, again, limited. Let's keep the distance if we can. Let's make sure everybody is safe and healthy, and let's limit the exposure and the risk.
So maybe no Marco Polo because our eyes would be closed and we might get too close.
Right. That would be one.
Okay, walks.
Walks are great. Again, back to this other thing of being physically active is a really important part of keeping your immune system up. And our responsibility as New Yorkers, as people, is to keep ourselves as healthy as possible. Walks are perfect. Walks are great.
in line with walks. I'm planning to play golf with 3 friends next week. I guess we're going to walk on the course, but golf safe?
Golf is great. Golf is another example of these sort of like non-contact activities where you can maintain distance, you're outdoors. This is a great activity.
Awesome. Bike riding, same as walks?
Bike riding is same as walks. It's a little bit less predictable, right? Because you're sort of on this bike, you could go from an area of very low concentration, very low density of people to very high density quickly. And I think that's bi-directional. So a lot, again, in the media about bikers and sort of a plume of virus that they could be shedding. So I love you bikers who are wearing your face masks and protecting kind of the environment. And, you know, if you're the biker and just sort of zooming past people, probably very low risk.
Okay, what about playgrounds? Parents want to take their kids to the playgrounds. Kids, little kids especially, love the slides, the swings, the monkey bars, all this stuff.
So this is an interesting example of how our understanding has changed, right? When we started COVID, this idea was that, you know, kids are just not so affected. So even if they got it, the symptoms were quite low. What we know now are that there can be very serious immune ramifications for a small very small percentage, but a serious percentage of children, and we just don't know where that's going. Also, children is challenging because they're not always going to remember 6 feet, right?
Sure.
They kind of get caught up. That's why they're so great. So again, it really is about limiting the who, what, when, and where. Who's going to be there? Where's it going to be? How much time are you going to sort of spend doing that? Are people wearing masks? Are they not? So rule of thumb, get kids outside, but do it safely. Observe what's going on and take the precautions that are necessary.
One of the other things that we saw when we saw parks and recreational areas starting to open up, in the beginning they closed the restrooms, and then there was a lot of outcry because people needed to go to the bathroom. So what about a public restroom? Is that a dangerous place to go?
Well, what's interesting about public restrooms is that they're actually designed to minimize infection, right? So public restrooms are designed to have non-porous surfaces and typically on some schedule of cleaning. You have to do your part. When you go in, if you see there's a line, wear your mask. Don't get right up on someone else waiting in line. Keep your 6-foot distance and know you've got your spot in line. You don't have to get too close. Get in, get out. Wash your hands. That's the other thing I meant to mention.
Yeah.
One of the things we know is like that is so powerful. Just washing our hands. And I think what a lot of us are finding is in our house suddenly the hand soap is like disappearing, which is great. And it's like, hey, what were we doing before COVID? Like, why were we not washing our hands all the time? But I think that's one of those things that will stay with us. Some of these safety things we're doing now are good things that we want to keep into the future.
Yeah, hot topic issue right now. So many people feeling the effects of graduation. People want to see their kids. I have a son. Is ready to graduate. We want to see them graduate. We want to see them, get their diploma. And people say, look, you see people in the supermarket, they're being responsible. You see the lines of people. Why can't people line up to get their diplomas? Maybe the parents are watching on a live stream. Do you think we can have some graduations in June?
Yeah, I mean, I'm not in charge of that. Thank goodness. But what I would say is that what you see across the country are some really, necessity is the mother of invention. And people are coming up with incredible ways to do this, both remotely and in person. We talk about sort of the drive-by graduations, so the drive-in graduations. There are sort of walls of graduates, that there are sort of individual celebrations. So I think that, if it's done well, if you're doing all these things to mitigate how many people, how much distance, can we do this outside? Can we do this in a drive-in way where everyone's just driving up and in their cars and watching graduates? I think there are lots of ways to solve these problems. We're a great country. We do a lot of problem solving, and I think it's being done really well across the nation.
And I think you hit on one of the things that's important too is the visuals. So when you give people visuals, because it is hard sometimes to judge maybe 6 feet. So you can put those marks or those place marks. We talked about the ocean beaches on Long Island opened up this week, and the state parks, and what they did is every other parking space put an orange cone. Limiting the amount of people in the parking lot will limit the amount of people on the beach.
That's exactly right. It's sort of the protocols that are for the people who are working there so that they have a good understanding of like how many people can be here, what is the distance, how do I kind of enforce this at all, but then also allowing people all the information they need to do the right thing, to keep their distance, and again, back to sort of the masks when there's lots of people around, and then just really enjoying the outdoors.
Yeah, so I think one of the fascinating things in this whole pandemic is that the emergency rooms saw a huge drop in people coming in, and one of the reasons is that car accidents were down. People were home, they weren't driving, people were staying in. Now people are getting outdoors, we may see some injuries. What would you tell people who got hurt and maybe are afraid to go to an emergency department?
Yeah, and I would say this is traumas, obviously, broken, sprained ankles, broken, but all of that. Absolutely, but even more than that, even just the preventive care, the healthcare institution was Johnny on the spot here in terms of making sure these facilities were safe for the patients. So really, the urgent cares, the EDs, your PCP offices, they have all re-engineered so that there aren't wait times, that you aren't around other people, that if anything, sort of the surfaces in these places are going to be pristine. So they're very safe to go to. And what we worry more about, and to be honest, is that people are not getting care that they need. They are postponing care because they are afraid. And it's like, no, if you have twisted your ankle and it's more serious than just a slight sprain, you could really be doing damage by waiting.
Right.
So if you need care, please get it. The facilities are safe. They are the healthcare experts. They have got this covered.
Yeah. We're getting a question right now from Eileen. Should people positive for antibodies still wear a mask? That's a good question.
Yeah, I think that this is going to be controversial, so I hope I'm not being too controversial. And what I would say is yes. And the reason is yes is that we're still learning. So you might have antibodies, but we don't know for sure. We assume it's going to act like every other viral infection, but we're learning a lot of different things about COVID. So how long does that immunity last? And are you counting every day down to the hour of, okay, I'm 21 days out, so for sure I'm good? It's going to be better to just wear the mask, to err on the side of caution. And also because there are other people who are taking cues. So if now they're seeing everyone not wearing a mask and now they're not wearing a mask, I think we just want to all together kind of move forward in terms of safety.
Yeah, I guess a good rule of thumb is when in doubt, be safe.
That's right.
Right?
That's
yeah.
right. And with the other thing is, there's masks and masks. Some people are very sensitive. There's a lot of different mask manufacturers out there. Find one that's really comfortable. Find one that's made of cotton. Find one that's breathable, so that's fitted to your face, because that's going to help you kind of comply with that more than maybe one that's irritating to you.
Sure. One of the things that I guess a lot of parents are having problems with is the small children, and it's very important for children to socialize. What would be your recommendation for children to get back out into socialization again?
Yeah, it is going to be a tricky one, because we have two sort of issues. One is that most kids really do fine, right, and are even asymptomatic and sort of asymptomatic shedders even, able to sort of pass the disease. And we also have this other problem but then a handful are getting very, very sick. And then we have kids who it's very hard to get them to behave in a specific way. And that's what play is about, right? That is the point of play, is that it's spontaneous. And so what I would say is these same kind of precautions. It is, the who, what, when, and where. Who is it? Are these folks who have been socially distanced? How long are we going to be together? Are we doing it outside versus inside? Make those good choices, and then everything sort of falls from there.
Yeah, and I guess it's always important too, like you talked about, hand washing when you're going to be outdoors, and in some of these situations, not a bad idea to have the extra sanitizer.
Absolutely, absolutely. So hand sanitizer, hand washing, the masks, all of that is part of it. And what you're doing is you're just sort of lowering your risk. I mean, I think a lot about it, in terms of what we see as normal. 50 years ago, no one was buckling their safety belt. It's like, right, we don't mostly have accidents.
Sure.
But now we just get in our car, we put on the safety
Sure.
belt, and we just know that that's a way to keep us safe.
We don't even think about it.
We don't even think about it, right? And, 50 years ago, I'm holding the baby, driving. and now we would never do that, because why would we take that risk? This is similar, which is, why would you take an extra risk?
Right. I guess one of the reasons for that too also is that, we're seeing great numbers here on Long Island. We're seeing the numbers go down, and even in New York City, we're seeing the numbers go down. But there is thought that we could have a second wave in the fall.
Yeah, I mean, the second wave it's not magic. We are anticipating that because we are going to start doing things together. So it's not, the second wave is just going to come out of nowhere. It's because we have to let go of some of this social distancing. We have to get back into our lives. And in that, we anticipate with more people close together, there will be more cases. I mean, I think one, we are very strong. We know a lot about how to do this, both in the medical field and also as good citizens of the New York area, which is we know how to stay apart from each other. We now all have masks, several. We know how to use hand sanitizer. So we are going to be part of that, making sure that second wave doesn't kind of look a lot like the first wave.
Okay. Well, this brings a good question from one of our viewers, Beverly. She wants to know, is it safe to wear a mask for too long? And especially now as it's starting to get hot. And I started noticing this the other day. I was wearing it and it's humid. So is there a danger to wearing a mask in the heat?
Yeah, so I think that's going to be different for every person. And as I said, everyone's a little bit sort of has different sensitivities. So clearly, especially if you have a medical condition where your breathing is affected, you have got to plan. You have got to plan for the fact that you're going to be wearing a mask, that it might be hot, and change your plans if it's going to be 100 degrees. Do not go out knowing that you're going to have to wear a mask. But in general, you have to use common sense. Put your mask on when it's appropriate. If you feel lightheaded, like you can't breathe, go ahead and get yourself distanced from people. Take your mask off, get some breaths in. You're not magically going to get infected if there's nobody around you, so that's really okay. And then the other part of that is you are going to have to start to do some mask maintenance that we haven't really been into thus far, right? Because you're outside, you're sweating, the thing gets wet, the thing gets contaminated. This idea of like, oh, I can't just keep wearing that same mask 100 times, and you see what I'm doing, which is not the right thing. I'm touching this mask.
Right, yeah, me too.
We're going to have to do a lot more of that kind of sort of precautionary, it's hot, these things are going to get sweaty and soiled, and we've got to keep them pretty pristine.
Okay. So we got a question from Tom. Is it realistic to think recreational sports can resume? And here we are at Eisenhower Park, where we have softball leagues and golf and everything else. So what about that? I mean, dying to get back out on the softball diamond.
Yeah, and my daughters both play ice hockey at this very rink, and that is a big question for all the parents. When can the season resume? It is, and it is almost sport dependent. It is dependent on the league. A lot of these leagues are really getting direction from their parent organizations, so people are going to have to follow what the parent organization is saying, and then really follow those guidelines. There are going to be sports where it's pretty straightforward. If you're a swimmer, that's a time, so you don't need 1,000 people right there at a swim meet. Soccer, all those kids are like right there, right together. So what does that look like to keep them safe? And then things like ice hockey, which are sort of in between. Softball, that's nice. Everybody can keep a pretty decent distance if you're not, stealing second.
Right.
But I think that's it is going to be almost a case by case, and it's going to depend on the sport, the kids, the parent organization, but everybody's anxious to get started.
Yeah, and so when we talk about sports, we're talking more outdoors, and one of the other things that's a big concern for people is that they need their spiritual communities. So a lot of people want to get back to their temples, their churches, their mosques. How does that work where it's now an indoor thing?
Yeah, I mean, and I think that is again where you're seeing across the nation examples of places of worship doing this really well, very safely, either through sort of a drive-in kind of situation or really limiting the congregation, limiting the length of the homilies, everybody's masking, we're screening for symptoms, and then you have the opposite situation where none of that is happening and you have infection rates, towering over 90%. That's a problem. So I think, again, lots of really inventive solutions, and I think when you deploy them appropriately, you can participate in these things, but it has to be done right.
Well, Dr. Zenobia Brown, thank you so much for taking the time to talk with us. This is very helpful.
That's great.
And I guess the bottom line is, before we wrap up, I guess when in doubt, always try to err on the side of safety.
That's right. Common sense. And really just be safe. Be safe out there. We've done this before. We flattened the curve. We can continue to do this.
Awesome. For Zenobia Brown, Rob Hoyle, have a great day. Stay safe.